In a session about basic epidemiology, we would like to discuss about what is epidemiology, the meaning of epidemiology, and uses of epidemiology. Epidemiology is derived from Greek word epi means upon, demos means people, logos means study of. So literally epidemiology is study about distribution and determinants of disease states or health related states and health related events occurring in the population. So epidemiology studies population in order to control disease in the population. But why medical doctors study epidemiology? What is it for? Because medical doctors usually they are interested only on individual cases, individual, rather than population. As a matter of fact, as a medical doctor, you will understand that population, the environment, be it physical, biological, and social environment, directly influence or indirectly influence the occurrence of disease or health-related events. So a doctor has to understand social determinant, and might not only social determinant, physical determinant and also biological determinant, whatever in the population, which influence health status, health states or health event, occurrence of health event, disease, for example, affecting individuals. So epidemiology is important not only for the population but also for individual patients, for understanding the causes and also the outcomes of disease in individual patient. So then what is the benefits of knowing more about epidemiology? What are the uses of epidemiology? Of course, epidemiology is a science, a study is a scientific discipline, and it exists for many, many years. Actually, from the beginning of medical science, since Hippocrates, the father of medicine, recognized that disease is not randomly distributed in the population, but it was affected by the climate, by the place where people live, by the seasons, and also by the behavior of the persons related to the culture of the population. So that is Hippocrates. But not until 19th century, 18th century that we recognize epidemiology as a scientific discipline. And it is important now not only to understand the burden of disease in the population. For example, in Yogyakarta, what are common diseases that affecting people here in Yogyakarta? Oh, we have a lot of diabetes, of course, of hypertension among older people. We have a lot of cancer, maybe #1 in the country. We have dengue hemorrhagic fever. We have leptospirosis. We still have a little pocket of malaria in West Kulon Progo. It's one district in the west part of Yogyakarta. So we have different kinds of diseases and also condition. We are second in stunting. What is stunting? A condition where we have a long-term deprivation in nutrition, stunting. So we have that kind of problem. We have many problems in Indonesia when we have to understand what are our problems here in the population. So then, from public health perspectives, then we can design a policy, yeah, to prevent the conditions, to control the conditions. But what about individual perspective? What about the uses of epidemiology by medical doctors? Yeah, because medical doctors treat individual patients. Well, you know, in this country we have a lot of cases with dengue hemorrhagic fever, and it is seasonal. So when a doctor is confronted with a child with fever, or now even an adult, yeah, with fever, then he or she has to consider differential diagnosis. One among others is dengue hemorrhagic fever. The doctors have to observe, yeah, symptoms and signs pertaining to dengue hemorrhagic fever. And also leptospirosis. When we know somebody with high fever and maybe with a deterioration of kidneys and also maybe also a disturbance of liver function, we have to think about leptospirosis because it is endemic, yeah? An endemic infectious disease in this area in Yogyakarta. And we have to understand also that out there, as a doctor, yeah, out there are plenty of old people with hypertension who do not take medication. What is the consequence of not taking medication when we have high blood pressure? Of course, there's a risk, yeah, high risk for stroke. We see many people with strokes in this area. And also heart disease and also kidney, yeah, chronic kidney disease. So these are the consequences of failing to prevent by treating high blood pressure. So epidemiology is important not only, yeah, to control disease in the population, but it is also relevant, yeah, for individual care, individual decision making for individual patient. Okay? So it's very relevant for doctors to understand because it helps a doctor to make decision, yeah, to fill the gap, yeah, between what should be done and what is really done, yeah, in patients. And in the situation of outbreak, sometimes we have an outbreak of disease which we don't understand what it is. Epidemiologists are called upon to address the conditions of outbreaks. Yeah, epidemiology help to complete the clinical picture of a disease which is the cause of an outbreak. So by have a complete clinical picture, then we can detect, yeah, we can detect early, yeah, diseases in an outbreak situation. For example, foodborne outbreaks. We have a lot here in Yogyakarta and surrounding, a lot of foodborne outbreaks. Yeah. Some of them even fatal, yeah, a fatal condition. Some died because of foodborne outbreaks. And not all foodborne outbreaks are infectious diseases. Yeah. Some of them were related, yeah, we know that they were related to insecticide. So we have to understand what are clinical pictures related to infectious disease causing the foodborne outbreak and also related to insecticide poisoning. Yeah. How we differentiate between common source outbreak and propagated outbreak. Yeah. Outbreak which is due to the transmission from person to person. And that is what we learn in epidemiology. Another use of epidemiology is, of course, we have to bring what we know in the population, in the clinical individual patient, to address basic science in the laboratories, yeah? Because we have to connect, yeah, clinical pictures, clinical situations, public health situation, and what we have to do in the laboratory. For example, we have to develop vaccine, yeah, to prevent infectious disease. And by developing vaccine, we are able to prevent a lot of diseases. We are able to eliminate important diseases, and even we eradicate already one infectious disease, smallpox. Yeah. Smallpox is basically eradicated in the world, yeah, since 1980. So this is partly the success of epidemiology, which is translated from public health, from clinical care to the lab, and then back to clinical patient and public health. So epidemiology cannot work alone. We have to collaborate with other disciplines, and at the same time, other disciplines also need, yeah, input, need strengthening of their knowledge, yeah, using epidemiologic methods and epidemiological body of knowledge. I think that is about what you will learn in basic epidemiology. Later on, we will discuss about specific methods in specific situations in the population, and also specific methods to address research problem. Yeah. Research problem. There are many research problems. It's related to innovation in medication, in treatment, or innovation in prevention. We need research to make sure that the innovation works, yeah, in the individual patient and public health. So this is the contribution of epidemiology. A lot more about that we will discuss in the other sessions of epidemiology. Thank you.